Hey, my name is Leonardo Peña, and I'm going to talk about the antimicrobial resistance and how this is affecting the world. So first, you have to know what is the definition of antimicrobial resistance. It's the ability of a microorganisms such as bacteria, virus, fungus, or parasites to resist the effects of medication previously used to treat them. Some examples of resistance in bacteria that you can find are Klebsiella pneumoniae, Escherichia coli, and Staphylococcus aureus. Klebsiella is a common intestinal bacteria that is involved in nosocomial infections such as pneumonia, bloodstream infections, and infections in newborns and intensive care unit patients. The treatment used for these bacteria are carbapenem antibiotics, but in most cases this doesn't work in all the people. In Staphylococcus aureus, there is a strain known as methicillin-resistant Staphylococcus aureus that can cause severe infections in health facilities. People with this strain are estimated to be 64% more likely to die than people with a non-resistant form of the infection. In parasites, you can find resistance to Plasmodium falciparum that causes the malaria, and in virus, you can find resistance in the human immunodeficiency virus or in the influenza virus. Uh, the antimicrobial resistance is caused because people overuse the antimicrobials because they believe that these treatments can be the solution for anything and should therefore be applied in the first instance to all disease. Also, inappropriate prescribing contribute to the promotion of resistant microorganisms. Studies have shown that treatment indication, choice of agent, or duration of antimicrobial therapy is incorrect in 30 to 50% of cases. Uh, the access to antimicrobial is not controlled in all the countries. The production and sale of the antimicrobials are not regulated in some countries, and you can buy, for example, antibiotics that you don't need to treat a disease. Uh, Other cause of this is the overuse of antibiotics in livestock and fish farming. Antibiotics are widely used as growth supplements in livestock to promote growth and to prevent infections. And this ends killing susceptible bacteria but allowing antibiotic resistant bacteria to thrive. And these bacteria are transmitted to humans through the food. Also, there is lack of new antibiotics being developed. This is because the development of antibiotics is no longer considered to be an economical wise investment for the pharmaceutical industry. Mm, So, this is an example of how antibiotic resistance spreads. So, i- in this side, we can see that antibiotics are used in livestock, and these livestock can be and the and and the bacteria from these livestock can spread through the meat that we eat, or through the crops that are contaminated by the animal feces. Or in this side we can see that it can be transmitted by a person with these types of microorganisms, and it can spread through the community or in healthcare facility to other patients. Uh, why this is important for us? Uh, First, there is this increase the mortality in the European Union and the United States. About 48,000 people die every year because of these types of microorganisms. Mm, Also, medical procedures like organ transplantation, cancer chemotherapy, diabetes management, and major surgery become very high risk because of the nosocomial infections. And also, this is creating an economical impact in health systems because this increase the cost of healthcare because patients will need to stay more time in hospitals and maybe need more intensive care. So this is a figure of the Nature journal that shows the number of deaths attributable to antimicrobial resistance every year by the year 2050. So in places like Asia and Africa, uh, there is gonna be around 4 to 5 million of people dying because of the antimicrobial resistance, and in places like America and Europe, uh, they are gonna have around 3 to 400,000 of people dying because of this. So this shows the importance of preventing and controlling infections by these types of resistance microorganisms. In conclusions, you can see that avoiding infections reduces the amount of antibiotics that have to be used and reduces the likelihood that resistance will develop during therapies. And we have to be aware of this problematic and always use antibiotics appropriately and safely. Uh, that's all. Thank you for your attention.